You are 9 days in. I just want to ask you broadly, how is it going, and how did your expectations compare with how it's actually been?
Let me tell you where we are today. As of tonight, 27.9 million vaccines have been administered. 49 million have been distributed. Nearly 5 million people have had both doses as of tonight. 2.7 million people have received them in long-term care facilities. The rate of administration is about 1.2 to 1.4 million doses a day. We need to meet the president's target of 100 million doses in 100 days, and we are trying, 24/7 to meet that goal.
In terms of the vaccines that we've got to work with, there's been so much hope about the Johnson & Johnson vaccine for a number of reasons. One, it seems like Johnson & Johnson is capable of producing very large numbers of doses. It's more convenient that it's a single shot rather than two shots. It just has to be refrigerated. It doesn't need to be in a deep freezer or even in a freezer in terms of its transit and its distribution. That all seems good. But the numbers today, just to a layman looking at it, when they announced 66% effectiveness against people getting infected, 72% in the U.S. part of the trial, that felt like a disappointment when the two vaccines that we've already got are up in the 94, 95% range.
So your numbers are right. But I think we need to look beyond just those numbers. In fact, there's another number, and it's 85. The number is 85%, and that's the effectiveness rate against preventing severe disease. In fact, there were 0 cases of hospitalization, 0 deaths, even with the South African variant with this vaccine. So maybe we won't be able to wipe out the virus entirely, but we can change the course of this disease to take out the morbidity and mortality. And that would be an enormous accomplishment. So in some ways, I'm sitting here and we just are very, very fortunate for the United States to have multiple vaccines.
In terms of the variants that are sort of thwarting some of our vaccine interventions right now, all the vaccines that we know of seem to have some lesser amount of effectiveness against, for example, the South African variant and maybe some of the other variants as well. As those variants spread more widely and as they become a larger proportion of the COVID infections that are out there, are we ultimately going to need whole new vaccines that are designed to attack them, or will there be boosters or tweaks to the existing vaccines that we've got?
I think it's probably the latter. I think we are equipped to do that. That's the advantage of the great science that's been done, the technology. But the fact is, and I was very concerned about the South African variant, but the data today, again, shows, just with the Janssen vaccine, that it can work against that variant in preventing serious disease. I don't want to get out ahead of the FDA. We have the next several weeks. The FDA has to go through all the data. The CDC committee, called the ACIP, has to study it and decide where and when and if it should be used. So I don't want to get out of ahead, but I'm sitting here a lot more confident that we can take the morbidity and mortality out of this disease.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.